So Nancy already read my title, so I don't have to say it again. But yes, my name is Rebecca Case, and my project is assessing the implementation of AAC systems from administration to classroom teachers. So the central aim of my project was to explore the process of decision-making that school professionals make in a local school district that either supports or hinders the implementation in classrooms of aided, augmentative, and alternative communication, also known as AAC. And I asked two research questions, which are how do the decision-making processes of the administration affect the implementation of aided AAC in schools? And also, I wanted to look into how different school professionals of varying levels of legitimate authority implement, interpret, and apply the federal laws according to some of the set standards federally. So for those of you who are unfamiliar with what AAC is, augmentative and alternative communication is defined as an approach to communication that helps to compensate for individuals' severe expressive and communication needs. Now, AAC doesn't have to use technology, but it often does. There are different low-tech devices like a picture exchange communication system, a PEX board. There's a mid-tech like a GoTalk, and then higher tech options like an iPad, or for those of you who are familiar with Stephen Hawking, he used an AAC device to communicate as well. So in my literature review for this project, I found different problems that are currently faced in the classrooms. So one of them is a broad interpretation of the law according to the Individuals with Disability Education Act, IDEA. There was this term of some educational benefit, and people were applying that very broadly to mean that some people thought it was a lot of educational benefit, some people thought it was minimal, and that was just leading to what they defined as de minimis progress. So students were not making progress on their school plans called an IEP. I also found that there was restricted vocabulary on these aided systems. There's a need to have everyday words on these devices. So one of the problems was there weren't enough words and there weren't the right words. So think about an overrepresentation of nouns. In your own life, how well would you communicate if you only had a limited selection of nouns to communicate every day and not verbs and other words that you usually use pretty frequently when you communicate? And then one more problem I found was a lack of training. So adult educators in the classrooms were reported to have lacked training. According to a statistic, 74% of speech language pathologists reported lack of training or no training when it comes to AAC. And SLPs are often the people who are supposed to be the most knowledgeable about this. So the theoretical foundations for my project, I really took this framework from Vygotsky and Bandura, social constructionist theory and social learning theory, which basically just means that knowledge comes from interacting. We need language to interact with others, and this needs to happen in classrooms for learning to happen in classrooms. So my methods, this project was a qualitative and explanatory case study design. And my unit of analysis was 3 different participants who were purposely selected. So this involved an administrator in special education, a speech language pathologist, an SLP, and a special education teacher. And then my sources of data, those participants, I interviewed using a semi-structured design, and I also took field notes from participant observation. I got to attend a classroom in person. And then once I collected all this data, I got to analyze it. So I used an inductive, iterative, and exploratory approach. Don't worry, I'll define that for you. Inductive is basically the opposite of deductive. Most people start with a hypothesis and then find data in a deductive approach. In an inductive approach, what I was doing is beginning with the data and letting the data speak for itself. in order to develop a theory. Iterative means that I was continually looking into it, and exploratory is basically just I'm investigating and finding problems. Instead of starting with a problem, I'm finding out what those problems are. And then I used a comparative analysis across the interviews, comparing and contrasting the different individuals in my project and finding examples and non-examples in my observation. And then I was able to find patterns through that data. And this is a chart of my results. So all three of the participants, the administrator, the SLP, and the special educator, are different individuals whose decisions pour into a classroom. The classroom is meant to then lead to the students inside the classroom, particularly in special education, these AAC users. However, there were some barriers that I found that was leading to a decrease in what the individuals who use AAC were getting. So these barriers are one, knowledge and skills. So there was a considerable problem with both a lack of training and a lack of information about AAC and how to implement it. Then there was a lack of understanding about roles. So each individual didn't necessarily know their clearly defined role in what they're supposed to be doing and what the other person is supposed to be doing, particularly a lack of understanding about what a speech language pathologist does in the classroom. And then an emphasis on the device. I found that many individuals tended to focus on the device and not the student using the device. So starting with the administrator, what the administrator found in terms of knowledge and skills is that there was a considerable lack of training that they found from other individuals. They said specifically teachers were the ones that lacked the most training. And in their definition of role, they found that individuals in the school district often got stuck on this idea that there needs to be this specialist who works with AAC. And she said that it doesn't need that. There really needs to be this general knowledge about AAC and not a specialist. And then with an emphasis on the device, she said that there should be someone helping individuals with the device, but I couldn't find anything about that in any of the other data that I found across interviews. Then when it comes to the SLP found with knowledge and skills that grad programs mention AAC, but don't necessarily teach it. With role, she stated that oftentimes people place all of the responsibility onto the SLP when she said that should not be the case. It should be other individuals who know about it as well. And in terms of the device, she stated that people need to look at other factors besides how to teach how to press buttons or use this device. It needs to be used to teach vocabulary and things like that. Then finally, with the special educator, I actually got to attend her classroom. With knowledge and skills barrier, basically what she found was that there was no training for her as a teacher or training for all of the aides that go into her classroom. She found herself having to often train the aides. So her role, she found, was not just training herself, but also training all the other individuals in her classroom. And then with an emphasis on the device, I found both in the interview and in the classroom observation that there was often an emphasis on using the device to request basic needs, but not necessarily using the device for instructional needs. So instead of learning, it was a lot of requesting items or things like that. And often I found the aides not giving wait time for the students to respond independently, and often the aide responding themselves on behalf of the student and not allowing them the opportunity to communicate. So basically, with these interwoven components of the administrator, the SLP, and the special education teacher, this should be a very strongly braided telephone line. However, it seems that there is this knot there of these barriers that are tangling this line. And from start to finish, somewhere the message gets lost along the way. And who ends up feeling that is the student who uses AAC. These school professionals weren't always sure of what they were doing when it came to implementation, often to no fault of their own. And at each level of authority, there was a lack of understanding about roles for how to implement AAC in the correct way. And finally, there was a lack of full knowledge of how to take all of these best practices and make sure that the federal laws are fully being applied. Some limitations to my project. I'm a novice researcher. I'm a novice to learning about qualitative study design and AAC, especially as an undergraduate. So my project, I really aimed to address threats to credibility, confirmability, dependability, and transferability. So with that, I really had to double check a lot of things with my mentor and make sure that with my structural design of my project and procedures that I was following them appropriately. And with transferability, it was limited, especially because of the population. It was a local urban public school, but that doesn't mean that it's always transferable to other schools. And also this data was collected during this pandemic. So as always, that should be taken into consideration. So the clinical implications, why does this matter? It really contributes to our current knowledge of AAC, especially with limited research in it. And these barriers keep existing and popping up in the local area and probably further out around implementing AAC in the classroom. Also, since there's a lack of training and people keep saying that they don't know how to do this, this also offers ideas on professional development. So people could potentially get that training either in grad school, continuing education, or some other form. It also highlights that some of these laws and in their interpretation are not being fully realized, and that could be a potential hazard or problem. And finally, it'll guide future efforts to learn more about how to appropriately implement AAC and determine the factors and variables to make sure that that social learning, that learning in the classroom is being used. Also, it'll guide my further research as I attend grad school. I know that I will continue wanting to learn about this. Some final thoughts. I thought that I could let my interview participants say this. So some quotes from some of these interviews. One of them said, what we're moving towards is that AAC is everybody's area of expertise. It shouldn't just be one person's job to know AAC. Everyone needs to be on the same page so that there isn't that tangle that's, I basically, in misinterpreting that message that is supposed to reach the student. And finally, another individual said that communication needs to happen all the time. We all have the right to communicate, and it shouldn't just be for 60-minute sessions with an SLP. It should be all the time and for everyone. All right, these are my references. And thank you to my mentor, Dr. Lisa Irwin Davidson. She has helped me so much. And thank you, University Honors Program.